how to brush your teeth, but that doesn't seem to translate to good oral health. What might the problem be? It may not be a matter of information.
Well, the disconnect is, actualizing it. Are people taking this message to their bathrooms in the morning? People brushing the way they're supposed to? Are they doing it as frequently as they're supposed to? Are they visiting their dentist or any other oral health provider for proper instructions about this? It's one thing to tell people brush your teeth in school, and it's another thing to actually do it well.
Okay. Let me come to you, Dr. Linus, and the question here would be the fact that as we were growing up, we're taught that you brush your teeth 3 times a day, but practically sometimes that is not possible. Is that still the rule, by the way? And then secondly, how do you circumvent that? I mean, it's not practical for you to actually brush your teeth 3 times a day.
I totally agree. That was the rule when we were in primary school, but sometimes, you can't carry your toothbrush to your place of work, but we normally recommend at least twice a day, morning and evening. And especially in the evening when, when you're asleep and the bacteria are more active. You're not talking, you're not chewing, you're not eating. And that's the point where most people forget. So if you're able to carry your toothbrush, which I also would recommend, to your place of work and brush your teeth, basically after every meal, then it would be good. But twice a day is sufficient.
Okay.
And it should push.
How to brush your teeth? How does one actually brush their teeth? Because I guess there are good ways and there are ways that are not as effective as good ways.
Absolutely. It all depends on your technique and the strength that you use. I guess it would need a demonstration. That's why we recommend that you visit your dentist twice daily. Every 6 months. But most importantly, especially with the strength aspect, sometimes when you use too much strength, trying to remove the stains and the discolorations, you tend to you wear your teeth out quite fast. So it should be a small round circle motion, not up and down and back and forth.
Okay.
Yeah.
All right. Types of toothbrush, are there particular types of toothbrushes that maybe are recommended?
Well, yes, we may not at this level mention any brands, but what I want to say about toothbrushes is 2 things. Number 1, you need to identify the right toothbrush for you. Toothbrush have different consistencies. We have hard brushes, we have soft, and we have medium. Your dentist will be able to assist you to pick the right type of brush. At the same time, you need to change your brush. Every 3 to 4 months, you need to have it changed for it to be effective in cleaning. Cleaning of teeth is a very mechanical process. It's about just removing the debris, So a brush alone is as effective.
Okay. And are these strengths shown on the toothbrushes when you're buying?
Oh yeah. When you buy the toothbrush on the pack, you'll be able to see medium, soft, and hard.
Okay. Let me come to you, Linus, and there are myths and there are facts.
Okay.
I have grown up knowing that eating sweets is particularly not good for your teeth. Is that a fact or a myth?
It's a big fact. It's absolutely a fact.
Okay.
It's not a myth. It contributes a lot to what you call dental caries, what people would call cavities or holes in the teeth. So you have to have that sugar together with the bacteria, which normally cause the cavities on your teeth.
So after eating sweets, what should one do to avoid that?
First of all, avoid eating sweets generally.
For those who can.
For those who can. And I say that because because I'm also the vice chairman of Kenya Dental Association. We did a project within Nairobi, and we saw the way school children have access to sweets in shops that are close by, and also beverages that come together. The biscuits are sellotaped towards the beverages, and they're cheaper. And you see that kind of access to sugary foods is not good for children. So avoid it completely, and then if you must, eat it during your regular meals. When you're having breakfast, you can maybe have a chocolate or during lunchtime and dinner as well. But snacking...
Why have it while you're having regular meals? I mean, the sweet still remains a sweet.
Because that gives your mouth a chance to recover from the acid. The bacteria and the sweet cause acid. So the acid attack towards your teeth is generally in one sitting, which is a lunchtime or a dinner time. If you take it in between, then your mouth it's not able to recover from the acid. I mean, the saliva normally buffers the acid that's in the mouth. But if you're consistently snacking, then the mouth cannot recover. And that is another reason why we say brush after every meal, because the toothpaste tends to buffer the acid that's in the mouth that eventually causes the holes, the cavities.
Okay.
Maybe just to add on that, I just want to say that the idea here is to make sure that you have very little contact time between your tooth and the sugar. The sugar could not just sweets, but any other refined
even things like
sugary
cakes,
foods, cakes.
What if you have tea with sugar? Does that still?
Tea as well, juices and all that. So we're trying to reduce the contact time, and that's why we recommend twice a day. Every 12 hours you brush, and just remove that, so that the process of decay does not start. The demineralization that takes place because of the acids does not start, or rather, when you clean it out, then you're able to arrest it.
Okay, and just to let you know, if you're watching, you're welcome to call, and if you have any questions for the doctors who are dentists in the studio, feel free to do so. We'll now open up the phone lines, and you're welcome to call, and we're talking about oral health, maybe something to do with your teeth or your gums. Let's look at bad breath. Is there a specific cause for bad breath, Linus?
75% of the time is mostly poor oral health. By that, what the items that we have discussed, not brushing, not visiting your dentist. Then there could be other medical conditions that cause bad breath. That caters for about another 15%. The regular foods, the garlics, those kind of foods, the coffee, those kind of things end up causing bad breath. And then 5% of it is psychological. I always say that because especially when you're in the clinic, you examine a patient, you go through their medical history, their dental history, and you really can't find a cause. So that also would mean that the patient is aware about it and thinks it's there, but in reality it's actually not there. Okay, I guess I don't know if that's a better situation of having a patient who knows they have bad breath as opposed to others who don't know, and it's the rest who have to suffer. Yeah.
Most of the time, a bad breath, most of the time it's the other party that informs you. You may not even be aware that you have bad breath, but most of the time it's your partner or whoever you're interacting with. That's the person who will come and tell you, I think there's a problem. And just like my colleague has said, 70% of the times, it's about the teeth, the gums, the throat, areas in your mouth that cause that. The rest of the times are just other issues that are medical.
Okay, I have a question that's come via Twitter here, and the question is, smokers' toothbrush are tough and bristled. Is that good? Can flossing be culturalized in Kenya? Let's start with the smoker. I didn't even know there's a smoker's toothbrush. There is, and it tends to be harder in texture than the regular toothbrushes. I'll go back to what I said about the hard texture eroding your teeth, causing tooth wear. Smokers tend to collect a lot of stains because of the nature of the smoke, so they tend to want to clean out the stains. Sometimes it's not possible, so it would be best to go to visit a dentist and have those stains removed. So I would really avoid what they would call smokers toothbrush, because it's harder in texture than regular toothbrushes, and that's not good for you. Is it actually real, or is it imagined that a harder toothbrush would clean better? It's all about the technique, not the texture of the toothbrush. We do give softer toothbrushes for patients who have undergone surgery, gum surgery, or even so that's to allow the gums to heal. Usually I would select a medium one, but hard very rarely. Maybe somebody with physical disabilities. All right, let's take a call from Terry Auma, who's calling from Nairobi. Good morning, Terry.
Yes, good morning.
Yes, and to your question.
Yes, I have a question. My gums, I feel like they're,
You feel like?
Yes, my gums are growing out,
Okay.
Yeah, so I was wondering what the problem could be, because when I brush, they tend to bleed, that part that has grown out.
And for how long has this happened, Terry?
It's been almost 4 months, and I've tried some toothpaste that will help stop the bleeding, but nothing has changed so far.
All right, thank you, Terry.
Okay.
All right, so Dr. Sampson, bleeding gums.
Bleeding gums is a very common phenomenon. This is one of the signs of gum disease. 80% of the population suffer from gum disease. And as I said, bleeding is one of the signs. What I'd like to tell Terry is probably she needs to consult with her dentist, if any, because there is a process that is going on that needs to be arrested. And it all starts again with proper oral hygiene. If you've not been able to clean well between your teeth and gums, you end up building dirt. Initially it's plaque, this whitish sticky substance that we brush all the time to remove. If you don't clean that out very well, it hardens up and forms what we call tartar, dental calculus. And this is able to constantly irritate the gum, hide bacteria, and cause inflammation. So anytime you touch your gum, either you're brushing, either you're biting into something, you see some bleeding. And this again will give you bad breath and all that. So the most important thing for Terry right now is to see a dentist. We do what we call professional cleaning. We advise at least once a year you have your teeth cleaned by your dentist. This will really help with the gum issue that she's talking about.
Is bleeding necessarily a sign of gum disease?
Bleeding is not necessarily a sign of gum disease, but probably all gum disease will have bleeding as one of the signs.
As one of the signs. Yeah. Okay, we have Israel of Yambo who says, honestly, I have never visited a dentist all my life. Where do I start? Linus.
Israel.
And I'm sure Israel is not alone.
Yes, we get that a lot from most patients. The biggest problem is that they fear coming to the dentist. I would like to tell Israel, please do not fear. We are good people. We also want to help you improve your oral health. So, as we said, it's good to visit your dentist once every 6 months. That's twice a year. So, I would encourage him to look for the nearest facility that he will be at. Ensure that is a fully registered dentist through the Medical Practitioners and Dentist Board. And I'm sure he'll be able to get assistance.
Okay, now Dr. Linus, you're with Kemri, and I know many, like Israel, and myself, I would definitely be victim of that, is the fact that we fear the dentist with all those machines that make that drilling noise. Thinking of needles in your mouth is a very, very scary feeling. Now, technology has not advanced in this day and age where you don't have to inject.
If there was, we would have won the Nobel Prize by now. It's not yet there. There's another option of general anesthesia, which most dentists don't advocate for, because most of the procedures can be done within the clinic. But there are ways that the needle can be painless. So we try as much as possible to make the patient comfortable. And if we have to use the needles, because not all procedures need the needles, then we try as much as possible.
How do you make the needle painless?
There is something we call topical anesthesia, which we apply to the area that we will inject. So, and then making sure that the injection is given very slowly, because the slower it's given, then the body adapts to it much better. And then we don't say words like I'm going to jab you, I'm going to inject you. We talk to the patient. We have to make you numb, especially with kids. We tell them the tooth has to sleep. It's some sleepy juice that we give them. So, and that's why I'm saying for Israel's case, we do get quite a number of them. And I also consult for the Aga Khan Dental Clinic. So we encounter the same issues.
Well, I must say that compared, I don't know if it's technology that has changed, but for me, my personal experience is I stayed for 6 years without going to the dentist because of a root canal that went wrong. But my latest experience is it's not that painful. So I don't know if it's imagined or it's real. So for anybody out there who's fearing, technology has come a long way. And indeed, there are ways that you actually don't feel that much pain. I think the needles may also be finer, such that it's almost like a thread.
I want to say, there are myths. There are myths out there. Oh, root canals are painful. Anytime you go to a dentist, you're going to suffer pain. I think the gentleman was called, let him take a broad step and see a dentist. Truth is that nowadays we have more dentists than we did probably the last 10 years. So your dentist is able to give you enough time and treat you even more gentler than the past 10 years. So all these factors really will help in trying to alleviate this pain and the myths that we have surrounding dentists.